Hello, everyone. Thank you for coming out to my presentation on Wolfram Syndrome, also known as DIDMOAD. Due to the fact that this genetic disorder, after diagnosis, will go on to cause diabetes insipidus, diabetes mellitus, optic atrophy, and deafness overall, usually before the age of 16. Before we get into all that, however, we need to focus on what kind of disease this is and how it's passed on to the children in the first place. Now, this is a genetic disorder that affects the WFS1 and or the WFS2 gene in the body, which is the gene that is responsible for creating the Wolframin proteins for the body. This Wolframin protein is partially responsible for the regulation of calcium levels in the cells of the body and is located in the endoplasmic reticulum in the cells. Most importantly, however, is the location of the Wolframin proteins in the pancreas, which is highly affected by the Wolframin proteins or the mutations of it. With the mutations of the proteins, it may alter the gene slightly to make it less effective overall, or completely rework the gene and cause it to not be properly created after all. That serves as a catalyst to the failure of the production of insulin in the body. With the nature of the Wolfram syndrome being an autosomal recessive disorder, the diagnosis can be made earlier in the childhood's life, before the first symptom can show, which is usually genetic testing or observations of DIDMOAD being developed later on during their adolescence. The chance of the parents passing on this genetic disorder raises with each pregnancy, as it is a 1/4 chance of the child receiving this disorder. It does not discriminate, as it affects both the male and the female population worldwide equally, given the nature of how it's passed down. One of the symptoms of the disorder stems from abnormalities in the urinary tract, which causes many painful changes to the bladder, and it is one of the more common symptoms for patients with Wolfram syndrome. One of the more common urinary disorders for the patients will be urinary tract infections. That will be a constant in their life, which will be caused by bladder dysfunction as a byproduct of the disorder. Another symptom affects the optics, or more importantly, causes early onset optic atrophy. Research shows that one of the telling signs for Wolfram syndrome affecting the eyes has to do with retinal thinning due to this disorder, and there's no treatment available for this part of Wolfram syndrome, but the best treatment only meant to delay early onset optic atrophy, with docosahexaenoic acid and omega-3 fatty acids that would help with the visionary aspect until the effect of Wolfram syndrome has become irreversible, sadly. Hearing loss is another common byproduct of Wolfram syndrome, affecting more than 70% of all patients with Wolfram syndrome. It has nothing to do, and it has to do with the dominant mutations of the gene WFS1, and that causes the development of low frequency sensorineural hearing loss. Patients who develop this type of hearing loss, that being low frequency sensorineural hearing loss, report to not develop any other symptoms of Wolfram syndrome, and that will be able to manage with the side effect with hearing aids and cochlear impacts overall. In sharp contrast, however, to hearing loss would be the neurological manifestations of Wolfram syndrome, and these are the most lethal to the patients that develop Wolfram syndrome, with disorders such as ataxia and brainstem atrophy at the top of the list. The progressive neurodegeneration that is often accompanied by Wolfram syndrome is highly dangerous. It can be attributed to the loss of gray matter and white matter in the pons, brainstem, and cerebellum. This disorder targets the patient's brain from childhood and is the main reason for a slow development of the brain as they grow to adolescence. And finally, the last symptom we have is the development of diabetes mellitus and diabetes insipidus during the patient's childhood and adolescence. These parts of the disorder are the most manageable of the other disorders and should be treated in the proper manner. Other disorders to the endocrine system include the manifestation of hypogonadism and hyponatremia, with the former being treatable with the standard, as one of the side effects are impaired fertility in males and impaired and infertility in females, and the latter being the side effect of dosages of desmopressin for the treatment of diabetes mellitus, and must be carefully administered so as to not force the patient to develop hyponatremia. Now, the past classification of Wolfram syndrome as a mitochondrial disease has been thrown out, as it is clear that this is an endoplasmic reticulum disease, And as such, the treatment has changed, as there must be new treatments and drugs that would target the loss of wolframin proteins in the body, and they must target this area of the cell in order to be effective. Now, two drugs that have been approved by the FDA are the 4-phenylbutyric acid and tauroursodeoxychloric acid, which may be effective in the prevention of neurodegeneration in patients with Wolfram syndrome by preventing the cell deaths in the endoplasmic reticulum. These two chemical chaperones would help stabilize the endoplasmic reticulum by assisting in its task of the movement of the wolframin proteins and would help stabilize the cell and all. Another treatment involves drugs that would help with the calcium deficiency of endoplasmic reticulum and prevent cell stress death that accompanies calcium deficiency. But the more important part is gene therapy and gene altering in response to the gene altering of the WFS1 gene by Wolfram syndrome, and it would focus on repairing damaged tissues on the various affected organs through the use of the clustered, regularly interspaced short palindromic repeats technology, which will be used to alter the DNA of the cell and to try and correct the WFS1 gene after its mutation. Overall, this disease is treatable in time, but further testing will be required to see if the treatments will work long term. In the meantime, the treatment of the manifestation of Wolfram syndrome are paramount to the lives of the patients, and it must be targeted at an early age through diagnosis of the patients. Thank you for your time.